Hi, welcome to today's webinar. It's part of the KaiNexus Continuous Improvement webinar series, and it's titled Driving a Culture of Accountability, Transforming Patient Safety with KaiNexus. I'm Mark Graven. I'm your host and moderator today. I am a senior advisor with KaiNexus, and I'm very happy to have three presenters joining us from Our Lady of the Lake Regional Medical Center. They are Lindsey Booty, Christopher Thomas, and LeaAnn Teague. So I will more formally introduce them in a minute. If this is your first time attending one of our webinars, welcome. Of course, if you're a regular attendee, we want to welcome you as well. But just a little bit about who we are at KaiNexus. KaiNexus is a software and technology company with an enterprise platform that supports all of your improvement and operational excellence work. To learn more about KaiNexus, please visit our website at www.kainexus.com or scan the QR code that you see on screen. So I'd like to more formally introduce our three presenters today. Again, they're all joining us from Our Lady of the Lake Regional Medical Center. So we have Lindsey Booty. She is the Supervisor of Performance Improvement. She drives excellence through data-driven strategies, multidisciplinary collaboration, and a strong focus on safety, process improvement, and quality education to enhance patient outcomes, operational efficiency, and to foster a culture of continuous improvement in healthcare. We're also joined by Dr. Christopher Thomas. He is an assistant professor of clinical medicine at LSUHSC and is the chief quality officer for the Franciscan Missionaries of Our Lady Health System. He specializes in reducing clinical variability, accelerating evidence-based care, and implementing quality initiatives. His research focuses on sepsis diagnostics, hospital mobility, and unit-based safety scores. He has more than 40 peer-reviewed publications. And we're also joined by LeaAnn Teague. She is the Senior Director of Performance Improvement. She excels in healthcare management, improving patient outcomes and operational efficiency. Her initiatives have significantly enhanced patient safety, compliance, and revenue. LeaAnn is dedicated to healthcare excellence, innovation, and collaboration. So with that, Lindsey, I will turn things over to you.
Thanks, Mark. So our organization has been on a journey to drive a culture of accountability within our patient safety realm, and we've used KaiNexus to help us to come up with some novel solutions to do so. So we are a hospital, as Mark referenced, located in Baton Rouge, Louisiana. We sit in Our Lady of the Lake Regional Medical Center, which is part of our Baton Rouge market. Our hospital is a level 1 trauma center. We're an academic medical center. And we began our PI journey about 10 years ago. And around that exact same time, we began to utilize KaiNexus as our PI repository to help us to capture all of the work that our team was doing and has been doing since then. We are a part of a larger hospital system, which is called Franciscan Missionaries of Our Lady Health System. And it's a hospital system across Louisiana and into Mississippi. And so all of our hospitals are looking to enhance their patient safety culture, our culture of safety for our patients. When we began to explore the challenge that we were having within patient safety rounds, we took a look at what the process looked like then, and that's how we kind of have it depicted on the screen. Our safety rounds team visits 83 locations across our market, so pretty widespread number and geographically located areas that the team visits. We visit once a week, and we, just for full transparency, our patient safety team is one registered nurse at current. So it's really important that that nurse is operating with utmost efficiency, not only for the safety of our patients, but also to make sure that our team is able to focus on more than just patient safety rounds, right? Our safety department has to handle more than just patient safety rounds. And so what our process used to look like for rounds was that we would go to frontline. We have always gone to where the work is done. When we go to where the work is done, we bring our patient safety nurse, we bring some of hospital administration and leadership, and our quality leaders to the frontline team members. And we speak with them openly and candidly and ask them what they feel like are the issues for their patients and for themselves. We have always, as a part of this process, captured their feedback, and we've boarded it manually and always boarded it to the Joint Commission's SAFER matrix. We have closing rounds, provided a summary via email to our leaders in the departments that we visited, as well as hospital leadership, summarizing what we heard on rounds that day and sharing where those items would have fallen within the Joint Commission's SAFER matrix scoring. Give us some consistency with understanding the scope and impact of the issues that we were hearing. We would return about 3 months later after visiting an area, and one of the first things we would do is ask the team again, what are the safety concerns that you have currently? And what we noticed that we were hearing is a lot of the concerns that they gave us the first time or in previous rounds, they would bring up again. And so this was a clear signal to us that our safety rounds, although we were listening pretty intently, did not have a full loop closure. We were not resolving issues for the frontline teams who were telling us of their priority concerns for the safety of themselves and for their patients. And so we knew that things needed to change based on that input. We also recognized that at the time, organizationally, we did not have a real-time source for producing our SAFER matrix. So weekly, we would produce what that matrix looked like from that week's rounds. And then when we would need to, in preparation for some of our quality meetings, we would put together, via Excel, a SAFER matrix for the previous quarter, what have you, of the organization. But we didn't have a real-time way to look at it. We didn't have a way to roll up items within our hospital or within the other hospitals across our health system. So we looked to KaiNexus to get creative with solutions. And one of the things that we did was to use their category and attributes. So with some really tight controls inside of our OI, Opportunity for Improvement template, we were able to create a category, which allows us to categorize the issues that we're hearing, right? We created a specific category called patient safety rounds. And so when the team hears a concern that may be related to supplies, they go ahead and they tag that this is a supply chain issue. But if the issue is arising from patient safety rounds, they also tag patient safety rounds. And when a person who is provisioned within the location of a patient safety department in our organizational hierarchy within KaiNexus tags an item as patient safety rounds, they are allowed to get some branching questions. And you see those branching questions boarded there in the second box. These are SAFER matrix questions. They are weighted attributes, and they are only available to be documented or captured by our team members who live within our locations that are patient safety locations in our health system. So we created some additional opportunity for those nurses to capture the output, but also didn't add additional clicks to anyone else's workflow by using the branching and tight provision and controls around who could access the SAFER matrix weighted attributes. And you see there, we use consistent language straight from the Joint Commission about the likelihood of the issue to harm a patient, staff, or visitor, and the scope of the issue as it is happening. Once we got our OI template or our intake where we felt like it needed to be across this improvement, we looked to our dashboards. So how can we use reporting to provide a clear, a transparent, real-time picture of what the current state that we're hearing from safety rounds was? And so this entire dashboard works off of that created date custom filter. That filter allows us to look as narrow or as broadly as we like to at what we're getting from rounds. And so we can go back and see, since we've begun using this in October of 2023, all the way to what did I collect on patient safety rounds last week, right? This allows us to be able to be really agile in meetings. We can pull up KaiNexus and we can display the SAFER matrix, and then we can toggle to whatever audience that we are speaking with to give them the graphical representation that we need from the system. A couple of the pieces that we built into this dashboard are tiles related to categorization. So when the team is categorizing and saying this originated from patient safety rounds, we always give a secondary category. Did it originate in patient safety rounds and is related to medication safety? Then we tag both of those categories. And what this allows us to see is how are our teams reporting concerns month over month related to category. And ideally, if we are having an issue with medication safety, more than one unit is going to let us know about it. It will become, a thicker bar in that stacked bar. And then ideally, with our modified improvements around patient safety around reporting, loop closure will happen, and then we will see it shrink back down to nothing or not be represented as we're visiting with teams. That's ideally what we look to see month over month in this graph. We also built within the dashboard a quick create button, so our safety nurse can, from within the dashboard, right there, create the OI, and because of her provisioning, she will be able to categorize the item related to the Joint Commission SAFER matrix. Aside from that, we have a Kanban view, which just provides, again, depending on who the reader is, a way to very quick and easily see how our items are doing status-wise. And again, these are all the items collected from patient safety rounds. You see some large numbers there. We don't have the create date filter turned on to anything. So this is kind of since the dawn of when we begun using the system back in October of 2023. And then really the main driver of this dashboard is the way that we were able to use those attributes to color code into the tiles, the 9 tiles that you see on the screen, which do represent the Joint Commission's SAFER matrix. What you see off to, if you're familiar with the SAFER matrix, what you see off to the left side of each tile should be really representative of what you know to be the format of the SAFER matrix. And then what you see across the top is kind of a lookup that we had developed some time ago organizationally as we were even using the matrix on paper to say, if an item happens to fall here, this type of leader is going to be needed to help us to mitigate or resolve the issue. So for example, if we've got something that is high and widespread, we are going to need to make sure that it gets assigned to a really high level leader in the organization to drive that change. So with those enhancements in place, our patient safety rounds no longer looks linear. It looks more like what you see on the screen here. So we have not changed anything about how we go to the front line. We go to where they are, and we bring a team of leaders who are ready and willing to listen to the team members' concerns. When we hear their concerns in patient safety rounds, we are entering OIs into KaiNexus and categorizing them directly from the create screen. KaiNexus helps us with the accountability piece. So it is able to provide notifications and emails to the leaders who are deemed to be responsible for the items very timely upon assignment, as the item is approaching its deadline, and then as the item becomes overdue, it's able to provide those notifications to the leaders. And what we've seen from that is that our leaders have begun to resolve the issues that we are entering as concerns from their frontline team members in patient safety rounds more consistently. We also have, in using a digital platform, we also have been able to have a real-time ability to visualize our SAFER matrix as an organization. And since we've begun to do this process, over a year ago, some of our sister hospitals within our health system have reached out and asked to adopt it within their workflows as well. So we've built not only a Baton Rouge patient safety rounds board, but we have safety rounds boards for our other hospitals within our health system. And that allows us to capture individually by market, as well as be able to give line of sight and direct transparency to a health system SAFER matrix view for those level leaders. So the impact that we've seen in using KaiNexus across our safety rounds, you see here on the screen. So the system has provided us automated tracking, visual management across several different aspects of the system. So we have visual management across that Kanban. We have visual management built into the SAFER matrix to allow us to see the priority related to an item. And then we also have the Safer Matrix built into our KaiNexus instance, and we're able to leverage that to understand what our team members are telling us their safety concerns for themselves and their patients are. We have kind of highlighted here 2 key improvements that we were able to hear as we began to revisit areas after we implemented these solutions into patient safety rounds. When we would go to the teams and we would ask them what was of concern to them, we stopped hearing the same thing. So whereas before they would often give us the same comments or same issues that they had boarded in a prior visit, we stopped hearing some of those same items being boarded. And that was a clear signal to us that this was actually closing the loop. More than just checking a box for the leader, the teams weren't reporting that the issue was still happening. So 2 of the ones that we chose to highlight here are around our supply ordering processes, them being streamlined for our frontline clinicians to get the supplies that they need on their units in a very timely fashion. And then specimen labeling. So we have experienced enhanced specimen labeling accuracy in our emergency department and our operating rooms, which are 2 of the key hotspots for safe specimen errors and specimen labeling errors. When we look at our metrics, again, we can't show you what our baseline was here because we didn't have a way to track this before, but using the digital platform allows us to be able to, with certainty, say that we have a 71% resolution rate across all of the issues that we are capturing in patient safety rounds and entering onto our Safer Matrix. Our cycle time for turnaround from the time that the item is heard at frontline safety round to the time the item is resolved is about 55 days. And while that's a starting point, we don't know where we were before, right? We know that when we would visit them a couple of times a year, we would hear the same issues being brought up by frontline as priority safety concerns. And then finally, this has strengthened our hospital safety culture. So we went live with using KaiNexus within our safety rounds in October of 2023. And about a year later, in October of 2024, we took an engagement survey for our frontline. And our safety culture scores from that engagement survey were very impressive. They scored us a 4.08 out of 5. That's something that we think is very indicative of the way that this system has been able to help us to build trust, help us to close items that are pressing safety concerns to our frontline team members and create a safer environment for our patients.
So Dr. Thomas.
So Mark, a couple of things that I'd like to highlight is that culture of safety survey for us ranks in the top 10% in the United States. So compared across it, we're in the ranking of the 91st percentile. And so I think that number is important because what you're looking at here is kind of the extension of where our safety culture is. We every day have small wins that are put in through a safety event monitoring program, and those events are resolved between an 8:15 and a 9 o'clock huddle. What you're seeing here is our desire and our ability to get to harder topics. And so that cycle time that you see in 55 days is because we're fixing the quick ones right away every day at 8:15 and 9. And what the teams have begun to give us over this year, which is reflective in their confidence at that percentile ranking, is larger items. And so as we walk across the Safer Matrix, what you will see is the teams are giving us things that they're not sure we can fix even. That for us is really the importance of giving a transparent culture and having closed loop communication. So on the top level, it also allows us to elevate where the voice of the customer is. They're giving us high top level outcomes of communication. They're giving us movement of the patient through. And those are ones that before, without this feedback loop, we may not have been able to see over time. So as it continues to get boarding in this digital format, we're now addressing these by putting them into our PI funnel. And when we go into our performance improvement funnel and we use it through our Lake Lean Management Office, we're taking what you're seeing at the top line of the Safer Matrix, and then we're putting them into projects and resolution. And these team members then are participating in both the process of citing it as a potential opportunity and in the solution. And then the other thing that I think is really critical is that when you look at the assignment, many people will think of the assignment of the impact, the harm, and the high and the spread. We're advocating that when they give us a conversation on safety rounds and we board this through the KaiNexus, that we elevate their voices. So if they feel like it's important and our team feels the urgency from them, we elevate it into the top of the red category and we ask our senior leaders to address it quickly. Oftentimes in safety cultures without a digital feedback mechanism, that importance can get lost. And when you return to the team members often aren't able to tell you, did you really take that as serious? For me, it was important. And because we're using this format and digital cycle, we can pull it up in high-level meetings and say, for our teams on the top level from last week, this communication pathway of how we converse with each other is critical. They're feeling it, they're telling it to us. And so that resolution time and those cycle times the resolution rate and the cycle times are because what we're putting now on this board over a year and a half are really important safety events. And they're really important things that are necessary for us to fix. They're just not quick fixes. So this has allowed the teams to communicate from this digital dashboard over to a really strong performance improvement culture, and then have them put in more near miss reporting every day so that we can close the loop in this safety culture of how do we access their voices and what do we do to make sure that we're transparently and clearly saying what you're telling us is important and we view it as important and we're actually going to elevate it just based on what you tell us in safety rounds.
So thank you again to Lindsey, LeaAnn, and Dr. Thomas. I want to tell you about our next webinar in our series. It's actually next Wednesday, April 23rd. This is the second time that we're doing a format called Ask the CEO. So we're going to be joined by Bill Kennedy, who's been CEO of a couple of different manufacturing industrial companies. And he's the author of, now his second book is coming out soon called From Panic to Profit. So I think it's a really unique opportunity to ask questions. You can submit those in advance when you register, or you'll be able to submit questions during the live session. You can register for that today by going to kainexus.com/webinars. And you can also check out more than 100 recorded webinars in our KaiNexus Webinars on Demand library. Next, please. We want to point out some other free resources that are available to everybody. One is our blog at blog.kainexus.com. A lot of articles about operational excellence and continuous improvement. And next slide, we also have our podcast series. So you can go to kainexus.com/podcasts. You can subscribe using Apple Podcasts, Spotify, any of your favorite podcast services. You can find us there, or you can also watch the recordings on our YouTube channel. Okay, so let's go into Q&A, and you can keep submitting those using the Q&A function. You're talking about, I think there's a question about culture. When you go on rounds and you ask people about concerns, what are some of the leader behaviors and ways of interacting with people that help people feel safe speaking up about risks or safety problems that have even caused harm in the past?
Yeah, that's an interesting question. When we began safety rounds, we had some leaders that needed some coaching because the leaders would tend to be a little bit defensive of the topics and want to provide the justification for why we did it the way we did it, or why it was, why it wasn't a problem as they saw it. So we kind of took those leaders to the side and said, hey, this is your opportunity to just listen to it from their perspective, and ask clarifying questions if you need to, but don't defend it, don't justify it. Let's just listen to what they had to say. And so over time, they became much more comfortable participating by really honing in on their curiosity versus their leadership type style, right? And so probably our biggest supporters are our senior directors of nursing. They love to come with us to hear what the teams are saying. And Sometimes they have answers to the questions. For example, we've had some issues with some older stretchers that we need to get stretchers replaced. And so the teams are kind of struggling with those, the old stretchers. And so our VP of nursing just stood up and said, hey, yeah, we have recognized that's a problem and this is budgeted and we've already ordered 8 stretchers. They should be arriving in the next 8 weeks. So he's able to say, yes, we heard you, we acknowledge that, and we have taken action on that, and this is what you should be seeing. And so those behaviors are very, again, I think back to what Lindsey said, earn that trust that it's okay for you to tell us whatever is bothering you and whatever is getting in your way, because we are going to make every attempt that we can to fix it. And so their behaviors are much improved over time.
Yeah.
Mark, I'll just add, I really think it's important when you first show up on hospital rounds that you are very transparent in 2 aspects. Number one, when you first start to create that culture, you have to get a quick win. So as we run through each of these units, we will make sure that the team who then assesses all of the things that are boarded and makes them in categories of either widespread or the severity, identifies one thing that we're trying to get solved that the team can feel and touch within 24 to 48 hours. So that's the first. The second is you have to acknowledge that some of the problems they're sharing are difficult. And the 3 words of I don't know in these rounds become critical to be able to assess. That is a really significant challenge. It may not just be one for us here in Baton Rouge. It may be a national challenge. But being able, particularly post-pandemic, to say, I don't know, to frontline team members to recognize what their challenges are as they're delivering care has become really critical. What they no longer, I think, helps us create a team environment is some answer that comes quickly or a message that comes quickly. It has become really important to listen and respond in a way that is honest and transparent, and then also to try to follow up with those team members when they share something that is difficult. We oftentimes in safety cultures don't recognize that the person reporting is also reporting something that was emotional to them or something they're living with as they go home afterwards. And what they're sharing with you is maybe the problem, but the event and the experience are underneath that. And so you have to be cognizant of that's what created the ability for them to talk about it. And we've had sessions where a person will talk and it requires us to thank them afterwards, because I think those are the 2 things. The I don't know and the thank you are really critical in 2025 because they're not said enough.
Yeah. And, to me, that all sounds very familiar for anybody in, let's say, even, back in manufacturing who's doing employee safety rounds, and the same dynamics about how we behave, how we react as leaders, even when people are reporting concerns that could affect them or their colleagues very directly. I mean, I think to some extent, safety culture is safety culture across industries, and I think that leads to another question of: do you use the same process to track any staff safety concerns, or is that managed through OIs outside of the SAFER matrix, or is there kind of a similar structure for staff or provider or employee safety?
Certainly, we've had team member safety. We actually make it a point on every location we go is to ask not just are your patients safe, but do you feel safe?
Yeah.
And so we will capture through KaiNexus things like, when we push on our sliding doors, they will just open. It doesn't take much pressure at all. And so anybody can get in or out of here. We will board things in KaiNexus like, we really could use another security guard, or we would like a handheld wand scanner to detect any weapons or, whatever coming in on patients. So yes, we certainly record in KaiNexus, use the same structure to capture those things that cause team members not to feel safe.
We do. We also have a patient safety event reporting system, as probably most industries have, that will record, because we're only visiting these units. There's 83 places we're going to. We're not going to every single day. So through this safety event reporting system, they can capture patient safety or team member safety events every single day. And we have in excess of 200 safety events reported every single week. Most of those, 25% or more, are near misses. But that's just more evidence of the culture that we've created and the trust that we've built with our teams to tell us what's going on.
Mm-hmm. Okay, we've got a question from the audience here. I'd be interested to understand if and how KaiNexus is used to directly capture safety reporting in a HIPAA-controlled environment. Maybe if you can talk about what are some of the HIPAA considerations when it comes to this process and your use of KaiNexus.
Yeah, so I think it's a phenomenal question because obviously patient privacy and protection is important. What you will see with our utilization of KaiNexus is we really focus on the challenge of the care delivery that they're reporting as opposed to the event. We use a safety event monitoring, as we said, for the actual event, which includes patient information. And then when we use KaiNexus in this, we're really focused on the process of care. So in that individual conversation, they may reference a patient or an experience, but what you will see us board will be the process. So for example, in our slides that you could see, one of them was about the transfer of patients throughout the hospital and communication. We know in every industry, communication as either in manufacturing as things move down the line or in hospitals as individuals try to communicate the care delivery, that's actually the focus. So we're very intentional when we use this product to make sure that we're not putting patient-specific information within KaiNexus, but rather we're putting in process-specific information that allows us to then come back. It is unique to healthcare in that, but that is one of the things that why we, in real time, when we utilize the system, those who are entering in are trained on those kinds of limitations and that we are focusing on process that reflects back to a person, but not a person, because the HIPAA information then goes into our safety event reporting, which is part of our patient safety work product. So I think that's important. The other unique feature of using a product like KaiNexus is it does allow you to separate the two so the teams can begin to focus on process versus person. Because as many of us know in our own safety event reporting, until you get to a culture of high reliability, the potential for people to put in a narrative that has some aspect of emotion to it, particularly when it's in healthcare, is significant. And so by using this format and saying we are going to focus on the process, it allows the teams to see both of those ways to report events. One in process where they tell us, hey, when we're getting patients from the ED upstairs, what we recognize is that our handoff tool is not used uniformly on the night shift. And then someone else will say, well, I'm recognizing that not only is it a night shift, but sometimes on weekends. And then as you start to think about new adds to your workforce, whether those in healthcare are locums or whether they're premium labor, you have to recognize that the onboarding requires you to teach the tools. And so it allows us a real time to come back into this kind of format using something that necessarily isn't specifically HIPAA, and to have the teams focus on process and then training the people that enter, which is why Lindsey said, we have pretty tight controls about the ability to enter into this system and then the distribution of the system, because we want to make sure that we don't cross those two at all in terms of protecting patient privacy.
Mm-hmm. Okay. Thank you. Thank you for the answer there. So that is all the questions that we've had come in. So maybe we will just go ahead and wrap up unless there's anything else either of you would like to say as we wrap up.
Yeah, I'll just add, and I don't think this came up earlier or through a question, through the presentation or through questions, is that The participants in our safety rounds, and this goes back to Dr. Thomas's point of try to find some quick wins with each of your rounds to again build that trust and build that culture. Is our security director will come with us, our information systems director will come with us, food and nutrition and environmental services are all there. And more often than not, it's in the environmental services and the information technology where you find those quick wins, because we're all working with computers, right? So invariably somebody says, oh, my barcode scanner is not working, or my printer is not working, or the computer in these 2 rooms has been giving me problems in the last 2 weeks. And so we capture those in KaiNexus to make sure that's closed, but I can tell you that those leaders are sending people, they are texting people while we are standing there, and sometimes we see the technicians show up before we ever leave the department to resolve that issue. So don't be afraid to, our teams are typically, it's not uncommon to have 7 or 8 of us from, multidisciplinary to show up on a unit. Don't be afraid to ask all of your people to show up, not just nursing, not just your ancillary departments, but get your whole support team to come in round. They don't have to come to everyone. They can send representatives, but it's very helpful to have them in your round.
Yeah.
The only other part, Mark, I think that is important for us to correlate to is as we've had new and younger learners enter in, this is the genius of Lindsey here in terms of working with KaiNexus and creating this and being nimble and being able to dynamically change, is that we now know that the majority of our workforce wants an electronic solution to conversation and communication and feedback loop. And so being able to adapt to that desire and that need, and then having them as part of the process and design, and then linking it to what some may have as a historical feature. The SAFER matrix has been used for a long time. So what we've been able to do in those two is blend a historical tool that's utilized in regulatory throughout time as part of Joint Commission, plus introduce that old kind of format to a newer technology so that we're able to connect the bridge in between our ages of people that are used to their own format. So it's a way to adapt to the customer, and specifically by adapting to the customer, then to create a reliable structure that then they feel like they've been involved with. So I would just say, in a healthcare format, you have to be willing at least to find great partners and then adapt your current state process over to future state process, and then allow them to give you feedback on that. And that's really where we feel like this has been the most significant in creating high reliability, is taking something that initially was novel to now everyone uses the language of, oh, I'm going to put that in, or I'm going to look at what my feedback loop is. And then being able to see it. I have emails from this morning that tell me, hey, this was assigned to you from a safety rounds from a week ago. You're now 7 days in. Can you solve this? And my answer sometimes is yes, and sometimes is, thank you so much for reminding me, and I have to do some work. But it prevents that failing to do loop closure that is really part of big hospitals, big health systems. The loop closure piece becomes really critical, and because we can see that feedback loop and the closure of 77 and the cycle time analysis, it's allowed us to really, I think, impact to the front line, and then be able to show them all of the things that we've done, and yet all of the things we have left to do, as opposed to what used to be an old school type process.
Okay, so I think we'll go ahead and wrap up. I want to thank everybody who attended today. I want to thank our 3 presenters from Our Lady of the Lake Regional Medical Center, Lindsey Booty, Dr. Christopher Thomas, and LeaAnn Teague. So thank you for sharing, about your people, your process, your technology, how this is all fitting together through your use of KaiNexus. So thank you. Thanks for being a customer. Thank you for doing the session here today. We've got a bunch of thank yous coming through in the chat.